This conference will now be recorded.
Now, the topic I was looking at doing today was on rewriting or modifying program designs to make them consistent with uh, the new rate reform that has been implemented here in California. Is that what people would like, or would they like me to sort of shift gears a little bit, because we only have at this point a couple of people on, so I want to make sure that what I discuss is relevant to your needs. Dina and Liz, do you have any particular areas that you would like me to cover today? You can just turn your microphones on and share with me anything that you'd like to have.
Good morning.
Good
This is
morning.
Deanna. Hi.
Hi there.
No, not today, no.
Okay. Liz, do you have anything that you'd like to see?
What you were talking about was find the rate reform. Yeah,
Okay.
because we are having to do the crossover.
Okay.
Yeah.
What I'll do then. Okay. So let's get started. Then. For, come on. Okay. First of all, the these courses provide you with continuing education credit. So if you need those for either your administrator certificate with Kern Regional Center and or your licensing, if you are a licensed facility, um, today would be 1 hour credit, and the other classes I do, the webinar every month, is an hour and a half credit. So, anyways, you must attend the entire webinar in order to be able to obtain the CEUs. You must identify yourself at the beginning of the presentation. Obviously, you both have done that. If more than one person is on the at your end, you need to let us know who everybody is who wants credit. So, because sometimes we just see who you, and then you need to email Irene at Bakersfield ARC, and there's her address right there, and identify 3 things today that you learned. So that way uh, um, we know that you were actually paying attention and got something out of this presentation. And that's pretty common for continuing education that's done online. Either there's some sort of a quiz or something after it at the end. So we do that. Okay, so there's a coworker on for the one. If you make sure you, and then so send in something, a paragraph or just bullet points. Doesn't have to. I don't want a book, but send something to Irene and let her know what you learned from our presentation today. And we ask that you send that in to her within 30 days, so that keeps it more up to date, and we can stay on top of things. When people come back 6 months later and say, "Hey, can I get credit for this course that I took?" It's more of a challenge for everyone. So, quicker you do it, better it is for everybody. Um, for those of you who aren't necessarily reading the newsletter or seeing the emails that have come out, there is a national training company that does training for many different areas. Not only our area, but for a while I worked in mental health, and they had training for mental health. They do for industry. They're just a firm that does professional trainings. And Bakersfield ARC, as part of this grant, contracted with them so that we have the ability to provide their training resources for our providers. Now, if you take them through our portal, um, we can track who's taking it, what you've completed, et cetera. And they have a little exam at the end of each session. And if you completed successfully, you can get CEU credits for that work. And the advantage of that is it is at your pace. So if you get in and have 20 minutes, 30 minutes, you can, and then come back. If you want to, let's say it's 10 o'clock at night and, you're having difficulty falling asleep and says, oh, what the heck, I'll work for an hour or something, I mean, you can go in at your own time, your own pace, take the classes. What we did was we went in and identified specifically 31 areas or seminars that we thought were specifically relevant to HCBS. So you can go in and shop, see which ones you like, which would be helpful for you, and do that. In order to do that, you have to sign up with Bakersfield ARC, because then you get a password that you can use to get in, and it'll be unique to you, and then you can take the classes. And Relias is a good resource, and we're very fortunate to be able to have this via the grant. And some providers have decided to use it for all of their staff. Hey, well, this is the way we're going to do some of our continuing education this year. Other people have not. So we have 150 slots. They're not all being used currently. So if you do have yourself or other folks on your staff that might be interested, you can give Irene or Valerie either a call or get a hold of them by email. If you're interested in seeing what the list of classes are, they can share that with you as well.
I went ahead and plugged in I know you have it there, but I plugged it in also in the chat, only because it's easier if we email, so that any type of communication I may need to have with each individual is just easier by email than having to write anything down, because it's the best
Perfect.
form of communication. So if anybody is interested, and we did have a large group over the last couple of weeks, several places
Signed
have
up.
inquired, and signed up.
Good. Well, it's a good resource, and if your organization wanted to do this yourself, there would be costs involved, and we're able to absorb those costs through using funds that were in the grant specifically to provide continuing education to providers of residential and day services. Okay. The rate reform for adult services. Okay, so if you're providing services to adults during the day, affected the following programs: community integration training programs, service code 055, community activity support services, service code 063, in-home day, which is some like residential homes provide day services within the residential home for clients who aren't leaving the home during the day. Activity centers, 505, the traditional day program. Developmental centers, the day programs of the more enhanced staffing ratio. The behavior management programs, the 515s. And then they have new service codes that most of these ones will go into, and those are going to be day services with a service code of 531, and there'll be different subcodes to that depending on your staffing ratio: 1-6, 1-4, 1-3, 1-2. And then they're going to have a new vendor category for behavioral services. So if you're a provider of behavioral day programs, this is a lot of times are providers who are working with individuals who have some major behavioral challenges that have been identified over time. And or some folks on the autism spectrum scale who have significant behavioral challenges, including maybe injurious behavior. And then finally, there's going to be a new service code for persons who have medical needs, who need medical day services. And so these are going to be the new categories that are being developed or have been developed, and that people will have to move over to in order to be vendored at this point. And I think you have till the 31st of March to make decisions and get all that taken care of. Now, Title 17, I'm sure some of you have heard that or had reason to access it, is the California Code of Regulations. The California Code of Regulations, what happens is our friends up in Sacramento, both in the two chambers and the governor, uh, go through a process by which they create law. Once those laws are created, so in the case of services to developmentally disabled, most of them can be found in what is known as the Lanterman Act. The Lanterman Act is a specific section of the Welfare and Institutions Code. There's a number of different codes there's a health and safety code, there's a penal code, there's, the state has a number of different places where they put specific legislation. So once a piece of legislation is created, such as having to do with developmental services, the state then sends it down to the appropriate department. So if it's maybe work related, it might go to Department of Vocational Rehabilitation, Department of Education, Developmental Services. So they send it down to them, and then that department then creates regulation. And regulation is basically how that law is going to be implemented. So, the folks up in Sacramento make the big picture, big picture, and then it sort of trickles down in terms of, okay, how do we make this work? So when they say that, regional centers shall vendor providers to do services to persons with developmental needs, then it's up to Developmental Services, Department of Developmental Services, DDS, to come up with a plan of how they're going to implement that. And that is where we come into Title 17. Title 17 is a very large area of the California Code of Regulation. So if you go back and you can go online and type in California Code of Regulation, and you'll see all the different titles. There's, I don't know, I think 24, 26 of them. There's quite a few. And the rules that basically govern how developmental services works are all in Title 17. Now, there's some overlapping rules in other sections of the California Administrative Code that also affect the people that we serve. Many of you have heard or work under Title 22 also. Title 22 is where the Department of Social Services has most of its regulations. So the Developmental Services is in Title 17, Department of Social Services is in Title 22. In Department of Social Services, Title 22 is where you find community care licensing. So if your day service, your residential service is licensed, then you would fall under both Title 17 for developmental services because you're a vendor of the regional center, and you would also fall under Title 22, which is the services provided by community care licensing. It's interesting because once in a while you'll find there's a one isn't totally in sync with the other. And an example that we've been seeing recently is the home and community-based waiver services. One of the rules, the final rules, says that a individual can have an overnight visitor in the facility. Well, so DDS is saying, okay, you need to follow home and community-based waiver rules. Title 22, which is the licensing rules, talks about that people who are residing in the facility, spending time in the facility, other than, just brief visitors, have to be fingerprinted. And you have an obligation to, maintain the safety and security of all the people living in your facility. So how do you can't necessarily get a security clearance on that individual that is coming in to spend the night with the class. So how do you sort of reconcile two different sets of rules? The issue of that individuals have a right to food at any time versus maybe the requirement to have specialized diets. And there are some overlap, and currently there is a working group of both people from the Department of Social Services and Developmental Services who are trying to figure out how to reconcile some of these differences between the two different agencies. So what I'm going to be talking about here for the next few minutes, that was some background on how the system works, is specifically Title 17 regulations on developing a program design, because again, our friends in the legislature said, that there should be a vendorization process for anyone who wants to basically do business with the regional center, to provide services to persons with developmental services through the regional center system. So California, the legislature set up the regional center system, and then they said to the regional center system, here's the format of how we want you, or the laws, how we want you to organize these providers, these service providers, because they're private entities, either for-profit, non-for-profit entities who are going to be providing the services. So how do we assure that we're doing business properly, so that we have a system for how we invoice things, how things are billed. We have a system that looks into making sure that the provider clearly states what they're going to be providing us. A system that provides quality assurance to make sure that the services that are provided are consistent with what's best practice for persons with intellectual and developmental disabilities. So there's a need to really have some strong oversight in terms of the whole process. And so that's what basically Title 17 is there for. And when regulations are developed under the California Code of Regulations, so if tomorrow the Department of Developmental Services, based on legislative authority, says, oh, we want to change, modify, create regulation, there's a process they have to go to. And once it's written, it has to be sent out for public comment. So there's usually a 30 or 60-day period where people can comment. Then the department has to take those comments, put them under advisement. They have to figure out whether the comments they received made sense, and they want to incorporate those into them, or whether they feel that the regulations as written are good, and then they can put them into effect. The one exception to that is what they call emergency regulations. If something that's a health and safety issue that they have to put out there right tomorrow, they can write those and put those out. But then they got to go back and do that process after the fact, and then make those emergency regulations permanent over time. So as new regulations are being developed, they do come out. So if you are sort of a government wonk like I am, where you sort of keep track of this stuff, I see when the new regulations come out, and at times I have given feedback in terms of, well, I like this. I think this could be done differently. You may want to make these following changes. So, just as an example, a couple of years ago, the department received a lot of feedback that the rules related to fair hearing, when a client, a consumer of the regional center, was trying to appeal a decision made by the regional center, they or their family. Some folks felt like it wasn't necessarily a level playing field, that the regional centers had an advantage in the process of setting up the appeals process. So the department used its authority and developed a new set of regulations specifically on how fair hearings were implemented. And again, it went out to public comment, did the whole process, and that was implemented about a year and a half ago to sort of level the playing field a little better. So, for example, regional centers at one time could bring an attorney into the fair hearing process. So here comes an individual who's receiving services. They come to the hearing, and across the table from them is a regional center attorney, or the family comes in across the table from them as a so now they've got it. So unless the family tells the regional center we're bringing in an attorney, the regional center can't bring in an attorney. It's things like that. So that was just an example of where the department looked at regulation and said, no, this needs to be changed. And so they changed that. Most of the regulation that's involved with program designs is staying the same. It really wasn't changed for the implementation of the new rate reform. But was changed is the fact that if you're having to move from, let's say you were providing services under 505, just an adult day services provider, and now you're going to be under 531, then you have to go back and look at what's required under 531 and see if you need to make changes to your program designs. And in many cases, people do. Now, one of the things that I have noticed over the years that a lot of vendors have done is, as the department has made changes and as regional centers come out to your program, kind of knocked on your door and said, okay, we're here to do a quality assessment, they have looked at your stuff, and in many cases they said, well, this needs a rewrite. You need to strengthen your client rights section on how you're dealing with making sure that clients are informed of their rights, and how you're ensuring that those rights are being provided to the individuals that you serve. So the provider writes an addendum and submits that to the regional center. And then something else comes out. They come out a couple of years later and they say, well, you need to revise this section. And the provider writes another addendum. And then these program designs become, here's the design, and then here are all these sort of add-ons to it. Also, many providers wrote their program design when they first vendored. And that, in some cases, it was a number of years ago. I was working at one vendor where I went back to look at rewriting some of the program designs, and I found that they had been done on a typewriter. They had been done so long ago that they weren't even on a word processing. So I couldn't get the one to make the modifications. I had to start over with it. So it's probably a good idea to go back and take a look at your program design. And even if under these new changes, you're okay, you can pretty much leave your program design alone, you may want to look to see if it's consistent with the rules, your own rules. in terms of what you do as a provider. So if at one time you were saying, okay, we are accepting individuals under the following criteria, and over the years you've expanded that criteria and you're accepting a wider range of individuals, you found that no, we're not very good at providing clients who have severe behavioral challenges. So we want to limit our services to those individuals, who have past history of challenges. So we've changed our criteria over the years, but if you go back and look at our program design, it still says we're accepting those individuals. So you may want to look at whether a rewrite is appropriate. Now, when you go into Title 17, it has like articles, and there's different sections. And if you go into the section that has to do specific
So the
to,
one thing I'm gonna take this.
go ahead,
Your
Cindy.
shirt. You know what?
Whoops. Um, the there are general requirements that everyone has to meet. If you have, for some reason, a need to waive the standards, in other words, go outside of the standards, there's a process that you can ask, a formal request to do that. But then you get into section 56712, which is the specifically program design. And this is descriptive. It tells you what you need to have in your program design. And then it goes on to talk about other things that are specific too. So, for example, entrance and exit criteria. Who can get into your program? Who are you looking at serving? So, as I was mentioning earlier, if you have a program design that specifically says we're not, well, you want to write it in a positive, not what we're not, but we serve individuals who are, let's say, on the autism spectrum with the following social, emotional, and behavioral needs. You can also put the age range if you have a specific age range. If there are health criteria of who you are able to serve, you would want to put that in there. So if you can serve some clients who have certain chronic health conditions but not others, you might want to put who you can serve in there. Also, exit criteria. When does somebody leave your program? In many cases, that can be things like the client says they no longer wish to have the program, the annual review, or during the year. They want to change their program. You find that they've met the goals and objectives that they had for your program. So when they first came in, they said they wanted to work on these skills. They've developed those skills. Now it's time maybe to exit to a higher level. The individual says, well, I've been in this day service for a while. Now it's time for me to go into a vocational program. I want to work, and I want to be in a program that would help me with getting competitive integrated employment. So I'm going to move to. So there are exit criteria. There's also many programs have an exit criteria if a client becomes dangerous to themselves or others in the program, and many programs consistent with Title 22 regulations have something specific to a 3-day notice for the program. And there's a whole procedure that if you're going to do that, you need to go back to Title 22, look at that, and maybe then incorporate that into your program design. So you need to have both who you're taking in and when someone exits from your program. And then a consumer placement process. How does somebody come into your program? What do you do And especially now with the changes to the home and community-based waiver that's been incorporated into uh, the services that we provide, you need to make sure that that individual has been offered choices about where they go for the type of programming that you serve, and they've looked at other types of programming as well. Now, it really is the regional center's responsibility to do this, but it is something that is in the rules, and that when I went out and was doing assessments of programs, that was one of the questions we asked. Was the client offered alternatives, other programs as well at the time that they first came into your setting? And if and in many cases, for those individuals that you've been serving for many years, that may be no, they weren't offered a choice. They were told, hey, here's the day program you can go to. But today we want to make sure of that. And I would have something in a program design, if I was writing one, that specifically says that that was explored with the individual when they came out to view your setting. So you talk to the client about, okay, this is what our setting can do. And have you been to other settings? Have you looked at other settings? Have you talked about to other folks about what else is out there? And make sure that so that you can put down in your file documented that, wait a minute, you assured that this individual was given their choice in regards to your program, and they decided that after looking at what was available options, they chose yours. So you want to make sure that you have that as part of your placement procedure. If you have other requirements that you want prior to the person's placement, that should be delineated. It's a good idea. I mean, you want to make sure the regional center has a checklist that they use for placement, both residential and day. Make sure that that's all completed, that you get all the necessary documentation. One of the challenge that sometimes has with documentation is that the records that the regional center have are not always entirely current. So the medical history on that individual and the psychological history on that individual may have been done when they were first intaked into the regional center, which could have been as a preteen, and now they're an adult and they're coming into your program, and so the documentations about their intellectual capacity, their health conditions, etc., may not be current and up to date. And so that's something you can work with different sources to try to get the best documentation as part of your consumer placement process. So consumer placement and funding termination process. Again, if somebody is leaving your program, how do you make sure that that's done consistent with regional center policies and procedures and funding? And in a perfect world, you're getting a 30-day notice. Doesn't always happen, and it's again consistent with what is in your program design for the facility and how that has been initially set up. You want to have something in there about your IPP documentation, how that's going to be done. Again, the IPP is written by the regional center, and sometimes those are not current and up to date. And so you want to make sure that if you're not receiving it quickly after the meeting, that you're letting them know and asking for them. They've just now gone to a new system that's online. It's a format that everyone in the state is using, and hopefully that will speed up the process of getting it done. It goes back after the meeting is done and is reviewed by the coordinator's manager. And sometimes that creates a backlog in terms of when you get those. But when I was going out and reviewing facilities, it was not uncommon for one or more of the people at that program to not have a current IPP. And that means that what are you then working on? Are you working off of last year's IPP when there was a meeting and some of the stuff that may have been decided on is now different from what we were working on last year? Or are you working on the new stuff, but you don't have documentation in regards to that? So you want to have something in terms of, like, if you're not receiving the IPP immediately, what are you doing to talk to the regional center to assure that you get that? Your program design should have personnel requirements. Do you have a job description? Do you have certain requirements that you've established for people who are working as developmental support professionals in your program? Personnel functions and qualifications. Again, what are we looking at in terms of the people that are serving those individuals in your program? And then training. What are you doing in regards to training those individuals to make sure that they're providing the services? Then you also have your program records. So any records that you're keeping about your program, where do those go? And then consumer records. You have some documentation about, are you keeping a file, an old-fashioned paper file? Have you switched to some of the new software that's out there that creates an electronic file for your clients? And then how are you evaluating your program? How do you know that you're actually, what you're doing works, that you're making a difference? And also, there's some standards about your curriculum. Do you have a program design of what you're doing with the individuals that you're serving, and what are the components of that? And then again, entrance and exit criteria, and these are additional standards. So there are some other standards. I want to move on here and get into some different areas. Here we go. I was looking at the time, and okay, one of the things that I don't see all the time, and which I really would encourage you to do, is to create a mission statement. Does your program's mission statement promote the values and services of community, based supports? Does it describe the people you serve as capable, able, contributing, and effective? So do you have something others that, we are a provider of services to individuals who benefit from greater independence, for community integration. So you really come up with a statement that really talks about what you're doing. I know the regional center has a statement about providing services as part of their motto, and I know a number of providers do, where they actually sort of delineate what is out there. So, Valerie, quickly, what is Bakersfield when they say ARC? What does ARC stand for the Bakersfield ARC?
It's advocacy on the A part, then respect and community, ARC.
Yeah. So advocacy, respect, community. So that's a mission statement. That's what they say, that they're really trying to do that for individuals. So, and because that's like, if you're going from point A to point B with someone, what are your goals? What are you trying to do? How is the mission communicated, and whom is it communicated to? So are you talking to the individuals that you serve about the direction that you're really trying to accomplish in your program? Does the mission statement guide staff in their provision of meaningful employment, community, residential-based services. In other words, and this stuff kind of flows from the top down. So if you as a leader in your organization are really promoting, wait a minute, the community is what it's all about. We really need to get people, fully integrated out there, with neurotypical individuals. How are we going to do that? We got the statement up here that says this is what we're going to do, flows down, and then people are more able to provide for those services. So in your mission statement, you want to make sure that your staff are aware of it, because I've been out to some places and there's a written statement up there, and it's kind of like, oh, that's a nice statement, but it has no meaning for anyone. So you want to make sure that if you do develop a mission statement for your program, it's meaningful and it's part of what you do. Does the work that is being done daily reflect the work described in the mission? So if you have a mission statement that says advocacy, respect, community, but then the clients are sitting in a room, watching, old movies all day, the two don't sync, and that's not the best of examples. But again, you want to make sure that if you have something that says community, that says employment, that says respect and dignity, how are you assuring that then becomes the cornerstone of what you do every day? A vision statement. Where do we want to go? Mission statement, vision statement, very similar type of things. Vision statement should reflect the home and community-based final rules and meaningful community-based goals, making it clear that the program is what you're trying to achieve. So, years ago when I first started in the system, basically we used to joke and we talked about, we were providing 3 hots and a cot. We were providing 3 meals and a bed for people, and that was the extent of what residential care did. The day programming was a place where people could go during the day that was safe, that was clean, that occupied the time between 8 in the morning and 2:30 in the afternoon. And there really wasn't anything that we had in there that was meaningful necessarily. And today that's changed. I mean, if someone is going to your program for 6.5 hours, whatever, what's happening during that time? And if they have an IPP goal, and you as a provider have a goal of where you want to take people, or work with them, you don't take them. I mean, they go. Where do they want to go, and how are you helping them get there? How do you help facilitate that? Take is the wrong term, because it means it talks about that we're responsible, and no, we're not. We're there to assist, and we're there to challenge, and we're there to offer the opportunity to move forward, and that's what we want to do. The more explicit the vision, the clearer the change is to everyone involved. So the more we make it really clear where we want to go, and we remind people of that regularly. So if you're sitting with other staff people and someone is perplexed, they're not sure what to do with a particular individual, or they make a statement that's sort of the old way of thinking about service provision, remind them of, wait a minute, this is our vision. This is where we want to go. So let's rethink this and think about how we can come up with something that's meaningful for this individual. When challenges arise, using a vision statement to communicate the intent. So exactly what I was just talking about. Something comes up. Wait a minute. We need to figure out how we're going to work with this individual. So we're going to sit down with them and we're going to try to move maybe in a slightly different way of doing things. And this is kind of how we want to move forward. And let's work with that individual to see how we can come up with something that works for them, that's important to them and for them. Does your current vision statement effectively reflect current program adherence to home and community-based goals and goals for the future? So are you, what you're writing down, that this is what our program is trying to do, is that vision for the future, for the direction that we're going, consistent with what the current state of the art, the home and community-based services? So are we in sync? What are ways your current vision statement could be more effectively reflect the full integration of choice-based services? So this is where you really want to look as you're rewriting stuff. So if you're putting a mission statement in there, you want to make sure that your mission statement is forward-thinking. And if there's something that you find in there that, we help people to do this, well, you might want to look at that language and look at, wait a minute, it's not a matter of helping, but it's facilitating, it's providing guidance and assistance, and working together on developing a direction. It's collaborative. It's but it's person-centered. Strategic planning. What kind of time frame are you looking at? And this can be for both the individuals that you're serving, but what is the direction of your the program that you're providing? This whole rate reform, and the fact that some people are having to now rewrite their program designs, the home and community-based waiver, has sort of shook up the system in many ways. That a lot of providers sort of looked at, okay, we've been providing services like this for the last 15 years, and we figure we're going to be doing this continually. We're going to do it over time, and the system is changing. And the expectations are changing. And what we are doing now is very different. And then you may sit down also and look and say, wait a minute, under this new rate reform and the new payments that I'm going to get, I need to look at whether the way I'm doing stuff is really the best for our organization. That maybe our organization needs to look at a different staffing ratio for the people that we serve, maybe a different model of service. For example, tailored day services, or paid internship services, or community integrated employment, or just a few examples of things that maybe we've been a day program, adult day program, for many years now, and now it's time, because of all the changes and the new requirements and the way the rate system is set up, that we really need to look at more creativity. And why is that important? Because as young people are coming up and leaving post-secondary education, they're leaving high schools, they're in many cases, the expectation has changed in terms of what sort of adult services they're going to be receiving. And again, before this presentation was starting, I was talking to a few of the people who were on early about the changes that are occurring in Washington right now. And will we, over the next 4 years, be looking at a very different federal funding system than we currently have? And if we do, and if that includes some major reductions, which is what they're currently talking about, how will that affect the service model that we're providing? And what is our plan? And what are we going to do should that occur. Um, what individuals, families, KRC input are you using? So, are you really talking with the individuals that you're serving and their families, or providers if they're in residential, or other folks that are part of that circle of support, and regional center? Uh, if you're not getting referrals, let's say, or they're very slow, and yeah, what's going on with our program? Maybe your program is not really providing what's the new group of individuals that are coming into the system or graduating out of the education system, or families' expectations of what they want for services. So you need to look at your plan. And if it's the same plan that you've had for a number of years, it's time for a change. And how is input used? So if you do talk to people and they tell you, wait a minute, we'd like to see something a little different, or I think I'm going to want to work. I don't think I want to go here for a whole lot longer. Do you have a work option for that individual, or is it time to move that person to somewhere else? And then if you do develop a strategic plan, who's it shared with? Do you just kind of put it in the file cabinet and it sits there, or does it go out to families, to the individuals that you serve, to the regional center, to and what is it used for? Does it go to your staff, to your direct support professionals? No, wait a minute. This is a direction that we're moving in. At Bakersfield ARC, we changed our day activity program from a site-based program to a community-based program, and that was done, during the height of the COVID pandemic, and in 2020 hindsight, I think there were some things that we did very right, and there were some things that we could have done a little different in terms of our strategic planning, in terms of getting staff and community and individuals involved. Things that we did very well, and other things that we could have done different. And that's really, and this is an opportunity to look at the way you are really developing your service model. This is something that I encourage you to develop, and I think this will be the last slide we do today, is what's called an elevator speech. And an elevator speech is, what would you say to somebody if you got on the elevator and you were going up, let's say 8, 10 floors, and so you had like 2 minutes, 3 minutes with that person about what you do, about what your program is, what you're all about. So, and this is really helpful, because if you're meeting people in the community, if you're meeting that individual who you're thinking about for your program for the first time, if you're talking to regional center service coordinators who, in many cases, are brand new and don't know the lay of the land in terms of what's out there, do you have a brief, clear description of what your program is? And it can be like even 2 or 3 sentences or shorter. So elevator speeches can be used at network events. If you're going out, hey, I'm coming up in the spring will be the vendor fair. So as people walk by your table, can you share with them, in a short introduction, what you're all about? And so also when you're interviewing people, you get talking to people about employment, when you're talking to community partners. So I've always encouraged people to develop this is a terminology that's in the business community, and it needs to be in our community too. Social services is having a brief introduction, and again, making sure that your program design makes it very clear that you're doing person-centered planning, and that has your organization adopted or created a person-centered planning tool. If so, which toll do you use? So, it could be we're working with the regional center and their person-centered plan. Many organizations have their own plan, and there are a number of them out there. There's that you can find and implement to do your individual service planning. And does each person receive supports having an individual plan that address their service and support plan? So how are you going to go about making sure that you're supporting each individual's needs? So the example that I oftentimes use is I've gone out to programs and they have a schedule on the wall that from this time from 8 to 9 is sort of free time, get people coming in off the bus, and we're getting ready for the day. From 9 to 10, everybody does personal hygiene. From 10 to 11, we do this skill. And so the day is actively planned out. Well, that may not be consistent with what the person has asked for in their individual program plan. So we want to make sure that the plan meets their needs. So with that, I'm going to open it up for any questions or concerns or any topics that people would like to see or hear. So just go ahead and open up your mic if you want to add something or talk or say something. Okay, hearing none, I'm the one going once, twice, three times. All right, well, thank you for getting on today, and hopefully this was helpful. And then next week there'll be another webinar topic. What we're going to be talking about next week is specifically how do you create or use boundaries that maintaining a professional working relationship with the individuals that you serve. And so that means what sharing takes place, how do you work with somebody to meet their needs. And so that's a good topic, and hopefully some of you can join us next week when we do that. All right. Well, thank you all for coming on today, and I'm going to end the session now.
Thank you, Jeff, for the session. And of course, to those of you that came in late, just a friendly reminder that we're offering the Relias training course through Bakersfield ARC. If you send me an email or Irene, we can get you set up and you get CEUs if you are needing that.
Yeah, thank you. Bye now.